our case here, we did the fractional ablative laser resurfacing for acne scars. You can see where we did the deep resurfacing, where we did the superficial resurfacing, where we did the overlapping resurfacing. We're now putting vitamins and nutrients back into the skin. This is vitamin B with hyaluronic acid. This is what gets damaged when the skin gets heated. So we like to replump the skin, because remember, if the skin gets damaged, you want it to heal itself really well. The second part we're going to put on here is his growth factors from his own blood, PRP. I was one of the first to do this technique 10 years ago when I was working a lot on HIV patients, to add these growth factors. And you can see the PRP, it's a nice yellow color. I know it looks like urine, but this is not. This is the okay stuff to put onto your skin. And this is all growth factors from your own blood. We do this now for healing purposes, because in the studies and the sort of expert things that I had done early on, it showed that people's redness and swelling and healing went improved so much more. So you can go ahead and keep putting that in. Now we're going to start microneedling that into the skin at about a 1 to 1.5 millimeter depth. Nothing crazy. You don't need to see a lot of pinpoint bleeding or anything. We already have pinpoint bleeding. The PRP will get absorbed into the system. Watch your ear, that's good. Will be absorbed directly into his skin. Okay. Through the channels that are created in both the laser as well as the microneedling channels. How does it feel? You're going to feel a little liquid kind of dripping. That's normal. So you see again a little bit more pinpoint bleeding, helping the product get into the skin. And now we're going to add some vitamin C and a mask to help him cool down and heal. And then the last component we're going to do is LED therapy, which I'll show you guys in a few minutes. So the next step, we're going to put the mask on. Go ahead and put the cooling mask. And that will really feel good. We'll wipe you in a sec. How does that feel?
No pain at all.
No, but how does this feel?
This?
Right now. Do you feel anything?
Just a mask on my face.
Yeah, but does it feel anything special?
I mean...
No?
Okay. I just feel numb.
He must be really numb.
It's very cold. It's very
really
cold.
numb.
But he doesn't feel it because he's numb. So now we're going to let him sit for 5 minutes. It's extremely important that we put the vitamin C, the mask on, everything, let him cool, and then we're going to do LED therapy. All of that together gives the best treatment for fractional laser resurfacing in someone with scars. Okay, so now are you guys live?
Yeah, we're live.
Okay, so now we finished the last portion. We cooled him down. So the last portion is to decrease the inflammation. Even though he's going to swell a lot, we want to make sure everything heals fine. So we're taking off a little bit of the blood. It's fine that it's there. We kind of want the natural growth factors on the skin. We're going to turn on our LED therapy for about 20 minutes. We need little goggles for him. Where are those? Where were the goggles that we just had? Okay, we'll keep your eyes closed for a minute because it doesn't hurt your eyes at all. It just gets bright. That's all. So we're going to turn on the LED, and this is going to decrease pain. This is also going to decrease inflammation, and I want him to just say how it feels. We're going to put it on his skin. Okay, and it's going to stay here for about 15 to 20 minutes. So how does that feel right now?
It's very bright.
Well, bright, but how does it feel? That's a sight.
I don't feel anything.
Perfect. So we don't want him to feel anything. We want him to relax. So now is when we put the music on and we let him sit for a little bit. Okay?
Is it okay for my eyes?
Yes.
Yeah, it
They're
won't
covered.
hurt your eyes at all.
They're covered.
Yeah, this is not UV light. This is infrared and LEDs. So he's going to be fine. And so that's the last portion of fractional resurfacing. And we'll hear from him later tonight, tomorrow, and through the rest of the week. And you'll see a final result in about 10 to 14 days and 3 to 6 months, the multiple amount of built collagen. Bye, guys.